afternoon, everyone. Good afternoon, Minnesota. I want to first of all say thank you all for your patience and understanding. What we're doing in the midst of this unprecedented health crisis is complex. It's incredibly disruptive. We understand that, and there are variables that need to be taken into consideration. So I'm grateful that for allowing us a little extra time. It's also about trying to strike the balance between our first priority, the safety and well-being of Minnesotans, and striking a balance with the civil liberties that we cherish so dearly in this state and in this country. Before I start on today's announcement, I'd like to just give a thank you on the response dealing with our public schools. What we announced yesterday was of the magnitude of what's coming today, incredibly disruptive, and I think most of us recognize in this room that this is our new normal. I think I would forecast for the press that this is more than likely a rhythm that we may get into as new information comes up, as new CDC guidance comes up, and changes in this unfolding situation come forward. But I say this as a parent. At about 4:30 today, I received information dealing with the shutdown from the St. Paul Public Schools, dealing with my 13-year-old. And I can tell you the sense of passion and the buckling down that must have happened today to the level of detail that the St. Paul Public Schools, where they're going to deliver lunches, how they're going to be delivered, if you miss the drop-off point where you can pick those up, where mental health services will be delivered, and starting to think about all of the variables of getting out the instructional materials. As a parent, I feel so incredibly comforted. As governor, I feel so incredibly proud that I asked folks to step up into a place where none of us had been, and in St. Paul, and I know this is being replicated in hundreds of districts across the state, they have risen to the occasion. So to Superintendent Gothard, to the teachers and educators in St. Paul Public Schools, and to the thousands across this state, thank you for getting started on the process of keeping our kids safe, keeping them educated. Earlier today, you heard Commissioner Malcolm give out the announcements that in the testing that was done yesterday, Minnesota had 19 new cases, bringing us to 54. I think many of us in this room have been forecasting that this will be starting to ramp up. We are now at a point that is a significant jump. We know it's uncertain times. We can't say with absolute certainty, but there are patterns in other countries of where this goes, and there is a critical point in time which we believe we are still at, that you can bend that curve and not overwhelming our healthcare system. And I'd like to take a moment to note that we have some folks here. You're going to hear from some folks from the industry, restaurateurs who are going to talk to you. But Andrea Walz from Health Partners, CEO of the health system, Penny Wheeler from Alina, and James Herford from Fairview are here with us, because we need to get this right, because it's where they're at that we can't cross that threshold where the people coming in for care outpaces our ability to deliver it. Everything we're doing, and started weeks ago, is to try and keep these numbers. We're not going to stop this from spreading, but we can stop how fast it spreads, and we can make sure that we protect those most vulnerable. So together in Minnesota, we're going to have to do this that way. Everything we need to do now to distance each other from this, to slow this pandemic, needs to be put into place. Many of you are already taking these steps to protect your own health, your families, your neighbors, and your colleagues. But I have to say, we're seeing folks still congregating in large numbers. You've seen that the CDC had went earlier today to groups of 50, where we had put out in our emergency executive order 250. The president announced today in his press conference 10 people to that. So this is now the time, if we are going to break this chain and we can go in the direction of countries that have been able to contain this and are now on the downhill, of others like Italy, who lost another 349 deaths today on behind 386 yesterday. That is a country of a much smaller population, and those numbers are getting that high. So this is the time to do that. To date, we've declared peacetime emergency because of the pandemic. We temporarily closed schools, give administration time to plan. To protect the public's health and slowing, today I am issuing Executive Emergency Order 20-03 that would place partial closures of restaurants, bars, and establishments serving food and drink for dine-in services, as well as places of public accommodation and amusement during COVID-19 peacetime emergencies. Today's executive order will go into effect by tomorrow, March 17th at 5 p.m. and run through Friday, March 27th at 5 p.m. Examples of the closures are restaurants, food courts, cafes, coffee houses, and others that offer on-premises consumption. This does not stop
takeout, curbside, or delivery. Bars, taverns, brew pubs, brewery, microbrews, tasting rooms, clubs, theaters, cinemas, museums, indoor-outdoor performance venues, gymnasiums, fitness centers, recreation centers, and so forth. Commissioner Malcolm will go into greater detail with this. This is all online for you to be able to look at the specifics around this. By issuing the order, we are enhancing mitigation measures to slow the spread. I want to be very clear. We are at a critical point here. If we get beyond that curve where community spread accelerates to the point that our hospitals can't keep up, that our respirators are not be able to, and some of the things that we need to get to folks, it becomes a really critical situation. And for us in Minnesota, I'm going to ask once again, we need folks' cooperation. To the young folks who are being told that, you know, it's not that serious and it won't get to you, perhaps not for you, but that's not a given either, because we have young people that have found themselves needing hospitalization on this. We need to stop congregating. We're going to close the bars, we're going to close the restaurants, we're going to close the places where we gather, and understanding that this is the magnitude of what we're doing is not lost on any of us. The impositions that it will cause on people are not lost on any of us. And I have to tell you, it's one of the reasons why I have a second executive order that we're issuing today that will strengthen Minnesota's unemployment insurance trust fund and ensure establishments affected by this order will have benefits available. Commissioner Grove will talk about this. We will be extending the payments made by the employers. We will be using the unemployment trust fund and removing the wait period time on that so that benefits are delivered immediately. Minnesota has one of the most generous unemployment insurance programs in the nation, and our trust fund at this time is in solid place to be able to do this. That is the mechanism that we're going to insure these workers as you're listening today for yourself, your friends, your family, and your neighbors. There is a safety net that comes along with this that will allow payment on those unemployment insurance immediately. We are going to make sure, and Commissioner Franz over at the Minnesota Management and Budget is shifting the state's workforce over to make sure that we're able to, and I think, again, to think about this, this will be the single largest request of unemployment insurance in Minnesota's history. Commissioner Grove will talk about this. It will certainly be the biggest one-day influx that we have ever attempted to process. We understand the sense of urgency around this. I ask Minnesotans to bear with us, but to understand we're not coming in front of you making a closure without having the backstops in place to try and ease this. It will not make you whole, but our intention is to try and make sure that it does not destroy your family or the well-being that you have. So we will remain focused to committing the slow rate of transmission across Minnesota. It's going to take all of us. I want to reiterate before I turn it over to Commissioner Malcolm that we are keeping open grocery stores and pharmacies, encouraging them to stay open, understanding how difficult this is, both in an urban setting and in greater Minnesota. Those are going to be critical infrastructure for us to make sure that people are able to get what they need. I would reiterate what I said yesterday. Please understand that we believe that the supply chain systems are solid to our grocery stores, to our convenience stores, and in many cases act as grocery stores in some of the areas where we have food deserts. But we need folks to be judicious about what they're purchasing, understanding that some people don't have the capacity to get it anywhere else. And I'll come back at the end, but I'll make that plea throughout this. This is an opportunity for Minnesotans to do what we do best. We step up in times of crisis for our neighbors. There are multiple opportunities to be able to volunteer. You're going to see these things start to step up, and there are going to be unintended consequences of social distancing that we're seeing. One of them that we're starting to see come up from the Red Cross is that blood drives are being canceled. Even though those are safe and they're doing social distancing and we can do it, we may end up in a situation where we're going to have Minnesotans in safe environments, protected from coronavirus, but still being able to donate blood for other needs that we have. Those types of things will go on as we move into the spring. We need to be prepared for mitigations against natural events, specifically flooding. So there's work to be done here. No one's going to do it alone. Minnesotans can do this if we step up together. Our commitment in state government with our private sector partners is to make sure that we're being as thoughtful with Minnesotan safety at our top priority. With that, I'd like to welcome Commissioner Malcolm to say a few words.
Thank you, Governor. Good afternoon. As the Governor has just indicated, slowing the spread of COVID-19 is very important for Minnesotans in our communities, and we can all be a part of this response, and indeed we must. As we learn more about the outbreak, we continue to update our efforts and our guidance. I think the governor has indicated this, as have I, that this is a fast-moving situation, and you can expect to hear additional information from us literally day by day, and our efforts literally are informed by changing circumstances hour by hour. Just Friday, we announced a broad set of community measures designed to limit the spread of COVID-19 by limiting opportunities for face-to-face contact. In line with our efforts to limit these gatherings that could lead to accelerated community transmission, we recommended to the governor that restaurants and bars close for dine-in services at this time. As the governor indicated, drive-through and takeout delivery can continue, and MDH recommends that restaurants focus on these services. Within restaurants, staff should try to keep at least 6 feet of distance from each other as much as possible. We understand that it's not possible every moment. Staff should be aware of any symptoms they are experiencing and critically must stay home if experiencing symptoms. Orders should be sealed by restaurants in tamper-resistant packaging. For the safety of delivery personnel, restaurants should encourage contactless delivery, allowing no face-to-face contact between delivery personnel and customers. Payments should be made via digital means whenever possible, and if possible, orders should be dropped off at a designated spot with no face-to-face contact at a distance of at least 6 feet. As the governor has also just reiterated, MDH strongly recommends, and we all want to help support grocery stores, pharmacies, hardware stores, and retail outlets that provide vital goods and services such as food, medicine, and essential supplies to remain open and to implement measures within those establishments to help promote social distancing. Social distancing should be encouraged within stores and at checkouts, and signage reminding people of the importance of distancing at least 6 feet apart. All this should be posted and reinforced among staff and patrons. When possible, delivery of items using the same safety steps I just noted for restaurants, online ordering and pickup should be encouraged over in-store shopping, especially for those Minnesotans who may be at higher risk, as we have discussed multiple times. Furthermore, MDH recommends venues such as movie theaters, bowling alleys, and other recreational activities close at this time. We recommended that to the governor, and he's included that in his executive order. We recommend that public buildings do remain open, and this includes libraries, so long as they can maintain social distancing of at least 6 feet between people. This guidance is effective starting by the close of business tomorrow, but we strongly encourage folks to start paying attention to this guidance right now and to avoid gathering in bars and restaurants as soon as they can. The guidance is effective beginning end of day tomorrow through March 27th. And at the end of that time, we will reassess to see if this closure order can be lifted or if it should remain in place. With Minnesota now having 54 confirmed cases of COVID-19, 3 of which we believe to be associated with community spread, it is time to take these actions in order to flatten the outbreak curve so that we can avoid overtaxing our healthcare system beyond the point that they can function. You can find more information about this latest guidance, as well as many other recommendations on social distancing on the MDH website. I will now turn it over to Commissioner Grove and anticipate your questions.
Well, thank you, Commissioner Malcolm, and hello, everyone. We know this announcement affects all Minnesotans, and in particular, it affects the hundreds of thousands of workers at bars, restaurants, the other establishments that the governor has announced will be temporarily closing today. We also know that this industry is really one of the cultural cornerstones of our state's economy, and that we're truly grateful for all that you do to make Minnesota a wonderful place to come together and enjoy each other and our state. And we appreciate you working with us as we take these measures, and we know we'll be doing that again in the future when this crisis passes. Given these unprecedented times, we want to do everything we can to help the hundreds of thousands of Minnesotans who will be affected by these temporary closures. And the most immediate lever that we have to address this crisis is the state's unemployment insurance program, which is making significant preparations to meet the needs of Minnesotans who will be laid off due to the COVID-19 crisis based on the announcements that are coming today. The state employees that work in the unemployment insurance program at the Department of Employment and Economic Development are working tirelessly to extend our hours, to handle increased call volumes, and to looking for creative ways to handle an influx of applications to that site. I want to thank those employees in our unemployment insurance program. We know you're working hard. We truly appreciate your hard work. I particularly want to thank our UI director, Jim Hegman, who has been a steady hand throughout this all as the UI program prepares for increase in activity. But preparation alone is not enough. Current UI law was not written to handle extraordinary times like these, which is why that executive order the governor mentioned a moment ago is necessary. And I just want to walk through a little bit of the details of that order so that we all understand what it contains. It is Executive Order 2004, and it is making adaptations to UI's law to cover a pandemic. It suspends the current rules of Minnesota's unemployment insurance program to offer immediate support to those who are affected by the temporary closure of bars, restaurants, theaters, museums, fitness centers, community clubs, and other spaces. In particular, it suspends the waiting week for unemployment insurance that will allow workers to take advantage of those benefits right away after they need to take advantage of UI. It also ensures that we make unemployment insurance benefits available to anyone whose health or the health of their loved ones is affected by this crisis. And it clarifies that you can access unemployment benefits if you are quarantined or self-isolated as a result of COVID-19. So the workers who are affected by today's executive order to close down those businesses the governor mentioned, you may be eligible for UI, you probably are eligible for UI, you should go to uimn.org and apply. The EO also addresses the issue of childcare, which I know is in the minds of so many Minnesotans right now. I know my wife Mary and I are thinking about this a lot for our 2-year-old twins as our childcare situation has shifted drastically, and that's true for so many Minnesotans. So if you are a parent who is experiencing childcare challenges due to the closure or cancellation of childcare facilities, you are eligible to receive unemployment benefits while you are away from work. So again, please do go and apply. The order also addresses the needs of businesses, as the governor mentioned, who pay the taxes that make this whole system run. We don't want those businesses to be adversely affected by this crisis. So we are suspending the employer surcharge for employers to pay into that unemployment system for the duration of this executive order. So this will provide some fast relief to businesses who need it most during this time. Now I want to make a very important point to everyone who is going to be looking at applying for unemployment insurance benefits in the coming days. It is critical that you use our website. I've mentioned it before and I'll mention it again. It's uimn.org. Our call centers are simply not set up to handle the call volume that we expect could come in based on this executive order, and we need to reserve those call lines for folks who don't have access to the internet or don't speak the languages that are available on our public website interface, those ESL applicants. So please, again, if you are applying for unemployment insurance, go to the website uimn.org to do so. We're also expanding the hours that our website will be available. It is currently able to accept applications Monday through Friday from 6 a.m. to 8 p.m. We're working right now to add Sunday hours. And I would just say this, we would ask for everyone's patience as the team scrambles to do everything we can to make this system work in these trying times. We have a great team in place that's working very, very hard, and we appreciate everyone's patience as we make these developments. Now we know unemployment insurance alone isn't the only tool that's going to be needed during this crisis. It is a start. We are continuing to look at other solutions at the federal and state level. One that I did want to point out today is the federal government's Small Business Administration disaster loan program, which we're continuing to get more guidance on by the hour from the federal government. We are working closely with the SBA and the business community and local partners to ensure that Minnesota businesses are eligible for that program. It will provide loans at a low interest rate for businesses that experience economic injury as a result of this crisis. We'll have additional guidance on that in the coming days. We believe that funding will be available within the next couple of weeks, so more to come from us there. Last, I'll just say this, these are unprecedented times, and I think you're seeing today an unprecedented response, and we would just ask the business community, many who we've spoken with over the past few days, to continue to collaborate with us, to be creative, to look for solutions. We have been impressed and inspired by the civic backbone and call to action that I think our business community and our workers have felt during this time of crisis. It really is a chance for all of us to come together and ensure that our economy can weather this time and make Minnesota better for everyone in the future. So with that, I want to bring up one of those business leaders who's here to join us today, and one of Minnesota's most well-known restaurateurs, Andrew Zimmerman. Andrew?
Thank you, and thank you, Governor Walz. We're in a crisis. the restaurant and the food industry is in the same place. Like others around the world, we are realizing that we need to take drastic measures to prevent the spread of the novel coronavirus and flatten the curve. Those measures will mean a greater percentage of people will survive this viral pandemic. Reducing gathering spots will help with containment, and hopefully real plans and real leadership, like the ones taken by our governor, civic leaders, will also restore confidence in our markets and institutions and ultimately get us back on our feet sooner. We cannot pretend that this real world crisis is not happening. Restaurants and bars are closing all around the country, some by mandate, some by choice. Service industry workers are losing their jobs. Small business owners are facing bankruptcy. Paid leave is being taken seriously in our industry for the first time. And in a state, like all the others, with food security issues, closings of restaurants and schools means a loss of access and meals for many Minnesotans. And still, these closures are the right thing to do in the interest of the public health. The hard choices now speeds resolution further downstream. Additionally, I feel we need to ultimately address the needs of hundreds of thousands of restaurant, hospitality, and leisure entertainment workers here in Minnesota. Traditionally, these industries employ the largest percentages of single parents, returning citizens, transient workers, and immigrants, especially new immigrants. Young people most often find their first job in the hospitality industry. Paid leave, health insurance, and saving plans have been historically lacking in our industry. Crisis organizations like Second Harvest here in Minnesota are struggling to deal with the waves of fear gripping this vital and beloved industry. Right now, many can't pay staff, rent, property, and other taxes, and of course, can't do that at all when there is no business. Fall off has been anywhere from 50 to 90% for restaurants, and that was over a week ago. Restaurants everywhere, including here at home in this state, have seen resources evaporate over the last month because hospitality folks all want to help. We all got into this business because of the magic that we know that happens when people share food with each other at our tables. Nobody wants to close, but we know that we must. Food people understand the greater good. We were first responders to 9/11, Katrina, and every disaster since. We always have been. So every restaurateur, chef, server wants to be the last one out the door. But the reality is that the public health needs to come first. That being said, I know that our food community stands ready to help. If we need to turn our restaurants into community food centers via public partnerships, we're ready for that. And I can speak for my organization that we will do everything that we can to facilitate any help for any and all Minnesotans whenever our civic leaders call upon us to do so. My heart breaks as I read letter after letter from chefs and restaurateurs across our state and country expressing the same ideas. We do need everyone to help. We need government bailouts of our industry, beginning with eviction protection, rent and tax alleviation, assistance for those without paid leave or health insurance. Help with loans for businesses and individuals should be on the table precisely because these restaurants employ so many, but also because they are small, consumer-facing businesses without cash reserves. We need to make sure that when this pandemic is finally over, and it will be over, that we have restaurants that can reopen. The harsh reality is that most won't. The food world is the vital cultural fabric holding us all together. I've spent 30 years preaching that message. What does a Minnesota without restaurants, food service, and a hospitality industry look like? We need to bathe this industry in dignity and respect as we close our doors and provide all our assistance when the time comes as we reopen them. Thank you very much. And at this time, I'd like to introduce my colleague, Stephanie Shin.
Thank you, Andrew. We are in unforeseen times. I started my business when I was 21 years old, and I can tell you that even the great University of Minnesota didn't teach a course in how to respond to coronavirus or a pandemic. We are relieved. Thank you, Governor. We're relieved to be here with you, stand with you in crisis and to know that we can keep our employees safe. We spent all weekend formulating plans, talking about whether or not we would go to takeout or to delivery. How can we both keep our employees safe and our guests safe, but do what's right for the community? And this is one of those times when we can do more by doing less. And it's really hard for someone like me in hospitality to say, stay home. But this is a time to cook meals at home and to be with your family and to do everything we can to help those in healthcare and to flatten the curve and to keep the hospital beds open for those who really need it. We hope to be here as an industry when all of this passes, and we'll be stronger than ever. And our restaurant community knows how to band together, and we know we can get through this if we all just stay home. Thank you, Governor, for doing this, and especially in light of St. Patrick's Day tomorrow, I encourage all of you, if you can do this today, tonight, do it now. The sooner we can all stay home, the better it will be for all of us. And now, John Puckett from Punch.
Thank you, Stephanie. The human dimensions of this are something I want to talk about, that we've been so sad as a company. My background is my wife and I started Caribou Coffee here about 30 years ago. We built that company to about 100 stores. And then the last 20 years I've been building Punch Pizza with my business partner who founded it. Today we're on a phone call with our employees, and we had to let over 400 people know that we're having to temporarily close our company. Through no fault of their own. This is a virus that's an unseen enemy that's rapidly growing. And for the good of our community and the safety of our employees, it's better that we all hunker down and protect our vital healthcare resources so more damage doesn't happen in our community. We are going to reopen. We're going to have a bright future, but the next 2 to 3 to 4 months are going to be very difficult. And we're very frank with our employees and management team about that. The restaurant business is a business that we spend 40 cents on the dollar on labor. We employ a lot of people per dollar of sales, I think more than any other industry. So we're really going to be affected. And I really thank the governor for taking leadership on this. We have a lot of employees listening to this tonight and are reading about it tomorrow. And getting immediate unemployment insurance will really help them make their own payments, make sure their family has food. And it's just a really terrible tragedy that we're all going through. We made the decision to close over the weekend after we had a couple of false and ended up being false reports, like potential contacts of our employees with the person that initially was thought to have the coronavirus. It turned out not to be true. And we didn't think it was possible to continue operation with increasing virus spread in a tight restaurant environment. So for the sake of the public, we think it's in the best interest of all that, again, we stop operation and we make sure that the health professionals can do their job and not get overwhelmed.
I want to thank all three of you on behalf of Minnesota. This representation that you just heard of people who have poured their entire lives in to creating not just an industry, as they said, a social fabric that sets Minnesota apart, and to hear them speak about putting the greater good and protecting our incredible healthcare assets, that's what Minnesota is asking for. That's what Minnesota needs. Your leadership at this critical time will not be forgotten. It sets an example for so many. And for those of you listening, I think the magnitude is starting to come home. 900,000 students were sent home. Several 100,000 of your neighbors were just laid off. An entire industry has been shut down in the face of this, all for the greater good. And as we triage this, and as we bend this curve, and as we keep our neighbors safe, I do think it's important. We're getting through this, and we're coming out the other end, and there's an opportunity here for us to do what Minnesota does, come together. These industries are going to need to be protected. These industries are going to need to, as we talk about it, ways that we can get together, and it's going to take public-private partnerships, if you heard, and it's going to take political will and political collaboration. And I hope that we all are seeing this. That's exactly what's happening in Minnesota. I met earlier today with all of the leadership in the House and Senate, and there's a sense of camaraderie and spirit and oneness about getting this right that I'm not sure, maybe some of us who were serving or saw the time after 9/11 where this country came together and can see a lot of good. We can do that in this. I would echo the message that Stephanie put out. Do this as quickly as possible. I'm not naive, and I send a message to Minnesotans, please don't go out for one more time to crowd the bars before they close. We've thought about everything. Don't make a rush if you can on the liquor stores, whatever it might be, to create situations. Do these things in an orderly manner. Understand that this is a short-term time that we're asking you to sacrifice for the greater good. Understand where folks are at on the other end of this, where our neighbors are going through. And so we get an opportunity here to implement this now in an orderly fashion, bend this curve, keep these precious resources in the hospitals ready to function, and get on the other side of that. With that, Tom.
Governor, getting a lot of questions from people on Twitter wondering about shopping malls, the Mall of America, hotels, restaurants that are in hotels, liquor stores. Maybe I missed it, but I don't see them.
Yeah, for every time we do something, and there's every question, I want to ask just, for the press, I think to think about how we talked about this, there has not been changing plans, there is evolving plans. At this point in time, listening to Commissioner Malcolm's and the Health Department's best laid plans, I think the one that comes to mind is people are saying, why is Mall of America still open? Where can people congregate? This information coming out is coming out almost hourly that we have. We're asking people to do things, and again, you can shop in the grocery store and keep the social distancing there. You can do some of these things. But I keep, and will keep reiterating this, I think it is altogether possible, and no, it is probable, that there will be additional executive orders. I would forecast for you, we're already thinking in measures around transit that are starting to happen, and how we clean our buses, how we clean our trains. We are talking with Met Council this afternoon. So these are things as they come. They are the best science and data of where transmission is most possible. We don't have the capacity. We are not answering every question. And the guidance that my team is getting and that I'm getting talking to other governors is, you're better off to move on this and then figure out what got missed and do the best you can to mitigate that. And we're trying to strike that balance. I cannot announce this closing without having in place the ability to do the UI and provide some assistance to these businesses. But there are a lot of other things that we're going to have to do behind it. So they're not wrong. I would just say this: there's a potential for those things still coming.
Before we do the next question, I just want to remind the governor, if you could just repeat the question for some folks who are viewing this on Facebook Live.
Can you repeat that, Governor? If you can repeat the question I just asked in case viewers didn't.
Yeah, I'm sorry for those of you out there listening because of the audio setup we hear. The question was from Tom Hauser, and it was getting folks texting in, and rightfully so, saying things like, "What about other businesses? What about the Mall of America? Where other people congregate?" That's not wrong, and we're not attempting to answer every single question at the time. My answer I gave said, based on the best data of the transmission vectors of where they're at right now, these are the places that we're dealing with. We are trying to balance that, of course, always safety first, and then thinking about the economic impact, and then the mitigation things in place, not just to mitigate the spread, but to mitigate the hardships that would be caused by this. We can't put people on the streets, and as I think Andrew so clearly articulated, this is an industry that these businesses are providing the best they can with healthcare, but that's very difficult. These are folks, and many times it's their first job. Many of us did this type of work when we were in college. We have to make sure, and then there's the professional and the single parents. So I'm not going to tell you that this fixes all that in the beginning, and I'm certainly not going to tell you that this is not the last time we're standing here, as further mitigation is needed. Esme.
On the unemployment insurance fund, how many people are you expecting to file? It's going to obviously be in hundreds of thousands. And also, did I understand it correctly that a parent who can't go to their job will be able to apply for this to take care of it?
I'll have Commissioner Grove answer. The question was from Esme Murphy, was about explaining a little more on the unemployment insurance, the numbers involved with that, and a clarification on parents who do not have daycare and need to stay home for that, their eligibility. So Commissioner Grove.
Thanks, Esme. I would say we don't know the projections on how many people are going to apply for unemployment insurance. We know that many people, at least some people, have paid leave available to them, sick leave. Those programs will probably pay you more than unemployment insurance, which pays you roughly half of your wages up to a max of $740 per week. So it's impossible to predict right now, but we know that hundreds of thousands of workers are affected by this. And so, again, I want to reiterate that for those who do apply, please do so via the website, uimn.org. And yes, your question about parents who have to take off work for childcare, I mean, the core tenet of unemployment insurance is to help those who have to leave work for no fault of their own. And if there was ever a time when there is a condition in the market that is no fault of anyone's own, it is a global pandemic. And so if you are faced with having to leave work to take care of a child because of these announcements thus far, we strongly encourage you to apply for UI, and the executive order gives us a lane there to help those parents.
And so you're asking people to go on your website this evening to do that. When might they expect their first check? Because for many people, this is paycheck to paycheck.
It is, and we would ask for some patience. We will processing time as quickly as we can. Usually within a week or so, we get you an account and we're up and running. But we'll continue to speed up processing as fast as we can.
Governor, there are folks who are concerned even beyond the restaurant industry about the food supplies in Minnesota. How are you and your administration monitoring that? What things are you looking for? When is there going to be a problem with this? And tell Minnesota that.
That's right. The question was the supply chain and the food supply to make sure that there is enough food, both raw materials if we're doing takeout, and then I assume in grocery stores is the question. I think we heard yesterday in the president's announcement that he had been on, especially with representatives of the largest grocery stores, of making sure that those, I think he mentioned Kroger and a few others out there. What we're doing is with the Minnesota Department of Health monitoring to make sure what that supply chain looks like, what the food supply looking coming in, and stretching how far back we have. A lot of industries now are just on time delivery, which we're finding out is a wonderful model for manufacturing. It is a terrible model for ventilators. It is also a terrible model if we don't have food supply in there. At this point in time, we have no reason to believe that we can't get that, but one of the things that we're thinking about is critical industries and things that need to stay in business. It's not just the grocery stores, it's the truck drivers who drive the groceries there. It's the freezer materials where they're stored, where they pick them up at a distribution center. It's the mechanics that work on the truck so that the trucks can pick it up from that distribution center and deliver it. So at this point in time, we have confidence in that system, but I think it's really important to keep in mind of thinking what those critical industries are. This is, and I'm going to reiterate again, this is why it's critical to have a plan in place. And I would also say, I think what governors are asking for, we spent an hour on the phone with the president and the vice president this morning, the 50 governors. We're really looking for that guidance from the federal government to provide a clear-cut set of protocols that are going to be in place so that we can ensure we're going to get there. Some of you have heard the comment that was made this morning, and it was disheartening to me that when we were talking about ventilators, the president's response was we should just go procure those locally. That's not possible in terms of, we're thinking creatively, and I would forecast to you, we're thinking about, and Commissioner Malcolm is getting an inventory of every single ventilator. And there might be one at a nurse's or a medical training facility at the University of Minnesota or Hennepin County College. Those are things we're thinking of, but when it comes to food, at this point in time, the supply chain is there, it's solid, and we believe that.
Governor, one follow-up. What can you tell Minnesotans? A lot of Minnesotans can't get toilet paper. They're buying canned goods and stockpiling those. Is that appropriate under these circumstances?
Well, I will say it again. The question was about over-purchasing of materials, about planning for the future. There's several mixed messages we get from people. The first thing I would say is that it's human nature to think about this. I think we tell people to plan for emergencies, and I don't think they see this as necessarily a negative. They're going out. What I would ask people to recognize is we have a lot of folks who don't have the capacity to store up a lot, and they're buying it week to week. And when we create a run on these situations, it throws that delivery system out of balance. There will be more coming in, but if everybody's just sitting there waiting to take it, and I think what I would tell people is take what's appropriate that you need and understand those who have enough at home right now, or stored enough there, our food shelves, Second Harvest Heartland and others are really going to be hurting. Now might be the time to maybe donate a little of that if you got that so that people can find it. So I would just ask people, be judicious. Don't over-purchase that. Understand the system is solid. It's not as if another delivery is not going to come, but if we take it all at once, it leaves people short.
Governor, can I ask about the medical?
I'll go here and then I come back to you.
This may have been answered yesterday at the education rollout, but could you explain for people who are asking why the e-learning is not starting till after March 30th?
Certainly. The question is, and the question was about why the distance learning is not starting until the 30th. This was to give time for the schools to prepare what they needed to do, to look and see how they were going to. And I was talking to teachers yesterday in the Rochester schools, and most of you would recognize they have a unique situation because they're going to have a bulk of healthcare providers because of the concentration of the Mayo Clinic, Olmsted County Medical Center. But a lot of schools are trying to figure out how do they work plans together. Teachers are getting together and saying, we will do the science units for the 4th and 5th graders. We'll do that on Zoom, figure out how to get there. I would also like to use this as a time of what they're trying to do is to figure out where the gaps are in terms of delivery of broadband and different ability to get it there with laptops. That's what the inventory that came to me today was saying. Do you have a laptop? Do you have access to care? This will give them time to say, if I say no and I'm living in a neighborhood where we need a hotspot, we'll be getting them there. And I want to give a shout out to a lot of our internet providers. One example I saw with Comcast, they're upping everybody's speed up to the top. They're allowing people to, if their bills aren't paid for the next 60 days, they're allowing them to call in and get access if they have a child at home. Our private businesses are stepping up to deliver at. This period of time was to allow them to put that all in order to meet the standards and move forward. It is a prep period. It's like what many of us do during late July and early August. We start prepping for 3 or 4 weeks to get that delivery of classroom material. Now they're just switching it over to e-learning. I promise I'd come to Peter.
Thank you. I want to put the health folks to work. What is it that you're requesting on the Hill right now? How much? What might the terms be? And what is that money needed for?
The question was to our health system CEOs here, and I'll let them decide if all three or if one wants to answer, is what they're requesting from us in terms of support for the industry on the side from the legislature and what they can anticipate some of their needs might be. Thanks.
Maybe I'll start and just with an appreciation for the governor and the commissioners on their leadership and for our colleagues. That the best way for us, and the question we're asked all the time is, do we have adequate supplies, rooms, staff, equipment to take care of people? The best way to do that for all of us to do it together and flatten this curve. So let me just emphasize that. In terms of what we're looking for, we know that there will be extra expenses in training and equipment and potentially facility changes. We don't know what all of those will be yet, but we have a partnership where we're collaborating all together in that and trying to raise what that will be for the future and for our needs economically. But just as the governor said, our first goal is to make sure we provide the best and safest health care for those who need it. You can help us do that by doing all we can to actually adhere to good hygiene practice and flatten that curve for us. And we're so grateful for everybody stepping up and backing these things and for the leadership of the government and these commissioners. Thank you.
How much and what are the terms?
Peter, I'll follow up. This time, those are being worked out right now. I'm going to speak a little bit out of order and candidly because these are unprecedented times. The number I'm thinking is somewhere around $150 million, and we will work out what those would look like in terms of, and that's as we're starting to anticipate what that curve looks like. I want to use Commissioner Fran's quote on this time is, a question mark times a question mark is a question mark, and that is the space we're in. But in the essence of as much transparency and as much information as possible, please use that judiciously, that's a number that's being talked about now, and each one of these institutions is kind of submitting or thinking about what they need. I think that's fair to say. And here's what I would tell Minnesotans. This is not going to be X amount of dollars. This is when it's going to be done, and this is when everything's back to normal. It's not that simple. And I heard the president today talking about July and August. And so I think we understand we certainly don't want to set unrealistic expectations, but I also want to realize that the business of democracy and the accountability of taxpayer dollars does not stop in a crisis. We simply don't have that answer, and as soon as we get it, we'll get it to you.
Governor, if I may go to a different element of the COVID response. Last night, Bill Ward, the public defender, recommended releasing prisoners, nonviolent prisoners across the state. We saw that Mike Freeman has acted, at least taken steps in that direction. I've talked to Pete Orford in Washington County. He's also on the record talking about having those same kinds of plans. Do you want to weigh in on that and perhaps the...
Yeah, absolutely right. Maybe if Commissioner Harrington, and these are still discussions going on. The question was about some of the decisions happening both here in Minnesota and across the country of county jails and other detention facilities releasing nonviolent offenders, folks who maybe were picked up because they missed bail or they had a parole violation for a nonviolent offender, of trying to get them out of that concentration. Nothing from the administration has been decided yet other than the spread of this disease and bend this curve that doesn't put public safety at risk. We are exploring.
Can that be extended to the DOC in any way?
Corrections. We've also had it with the local counties because we have many of our workhouses and juvenile detention centers that are actually run by the county that are separate from the Department of Corrections. And so we're having a conversation with the county sheriffs, 79 of which have jails and need to have some understanding of what they're doing. And we're talking to them about visitors, about virtual contact with lawyers. We're also having that conversation with the county workhouses, and we're having that conversation with the Department of Corrections. So all of those have been talked about in terms of the general tenor of what do we need to do in terms of public safety. And in fact, I would add in there that we're also having that conversation with the judiciary, because the judiciary has a primary role in making the decision about who gets released, who gets sentenced, and what methods we're going to be using. So we're also starting to have that conversation with them also.
Commissioner Malcolm, I have a question for you. And again, if you could repeat this so people at home can hear it. Getting a lot of viewers asking about dentist offices, hair salons, these places, very personal services where people are in close contact. Any recommendations on that? And then as a follow-up to that, any of the new cases result from community transmission, or the new cases announced today, were those all due to travel? Those two questions.
The question was around other sites where we know people gather and sites where there is, of course, close contact, such as dental offices. I think the other example was hairdressers and the like. Just to reiterate something that the governor said earlier, in getting today's order out about bars, restaurants, other entertainment venues, places where people gather, mostly for fun and enjoyment, not for essential services, that was our priority today. Because of St. Patrick's Day certainly being just an amplifier of that effect, but seeing that people weren't picking up the suggestions to do more voluntary social distancing, we felt compelled to move earlier, faster, as fast as we could on these announcements today. I can't speak directly to what more might be coming by way of guidance, but certainly the social distancing guidance applies to all of those environments, certainly. But when we know that there are services that require hands-on care in the healthcare setting and dental care settings, there's a pragmatic consideration that social distancing isn't possible in every encounter, but where, as much as it can be done, it should be done. In terms of today's 19 cases, I believe when I left the office, I did not have any information on characterizing those cases other than the demographics. But again, I think, just to reiterate again, another reason why the speed of moving on these enhanced community mitigation measures today is, as we are seeing the demographics of the cases, a significant number are in younger people who may not have severe illness themselves, but are in a position to spread the illness to those at higher risk. And those are the very folks who are still congregating in these social settings that we really want to get the message out strongly and quickly that for the good of the community, as has been discussed, they need to stop. So I can't tell you what number of cases are community spread, but I'll tell you quite honestly, I think as the numbers continue to grow, as the epidemic matures, and again, we're all trying to slow down and even out that spread, I expect that the majority of the cases are going to start to be community spread. That's just what we expect to see from here on. And that, again, was part of why the acceleration of these measures.
Is there new guidance or modeling showing how this spreads among asymptomatic people? Because we heard things a week ago about not too much concern about people who weren't symptomatic, but it sounds like that shifted a bit.
I think the question is what about the risk of people who are asymptomatic being able to transmit the virus? And in the case of what I was just talking about, younger folks who may have the disease and have a very mild illness and are still walking around the community because they don't feel that bad. They still may be in a position, they're not totally asymptomatic, but it's not severe enough that they're staying at home. We're still learning about the transmission potential for people who are completely asymptomatic, and we don't think that's a very high percentage, but it's not zero. So again, I just want to mention that the information on this is evolving so fast. I think the CDC's guidance late last night was informed by by new information coming in from the United States. So we're just going to have to keep on this and keep evolving our guidance daily and even more frequently as the information becomes more clear.
Governor, can I ask you about the end date to both this executive order and the school executive order? It's March 27th. Many Minnesotans may think of this as, well, a blip, and so they'll get back to their normal activities after that. What is your message to them?
No, this is the beginning of it. I think the question that came earlier about schools planning, that actually ends on the 27th. I think the expectation here is that these will, of course, be re-upped. This is to set the parameters, if you will, set the level, understand what we're at, be able to move and changes in that. And I think most of us understand there will probably be a further extension. And I would segue that back to Tom's question about folks asking about these other scenarios. I'm actually encouraged that people are thinking about these scenarios. And there's actually a cottage industry on Twitter poking holes in the logic of, well, why did you do this and you forgot this? We can't encompass it all, but if people are thinking about this, what I would tell you is, if it is a close proximity and you're worried about that, and you're worried someone there might be sick, those are the things we need to avoid. I mean, we're getting to that point now that if it seems like it's not a good idea, it's probably not a good idea. And again, as long as people keep thinking about that, but what I can assure you is we are trying to think through all these scenarios. We have not forgotten or thought that we did this without giving any thought to dentist's office or to dental hygienists saying they're put in that position. It's just going to be ever evolving. And the date on this is just to set that parameter, and it looks like that's what most folks are doing. And then I would just forecast right now, I don't see a situation in anywhere around the world where there wouldn't be an extension on these dates.
One more question today, folks.
Governor, may I ask you about Indian casinos? We're getting a lot of viewer questions about Indian casinos, right?
Yeah, and we spoke, Lieutenant Governor was speaking with Chief Executive Benjamin from up at Mille Lacs. They have made the decision they will be closing all of their facilities. This situation of our sovereign nations, we are in close proximity or close communications with them about what they're going to do. They have the ability to make the decisions themselves. They have their own healthcare system. We are coordinating and giving as much information as we can. I think what you'll probably see is those decisions are made by those sovereign leadership in each of the nations, that they will probably move in that direction, and we are in close contact with them. So I think what you're starting to see already, at least at Mille Lacs, I know that tonight that order is going. I cannot speak to the others at this time. I haven't been updated on, but they're right, because I heard somebody tell me they drove by and these things were packed. And I would go back to this again. I understand the human nature part of this. I think one of the things that there was a belief, and I think there'll be time, and there should be time to critique how this happened, of folks not believing in the severity of this, of not believing how important it was, and they didn't understand quite that much. I feel like that's starting to drift away, and I think you'll see a cascade, as you heard some of our restaurateurs talk about. John, others were already making this decision on their own. I think the same will hold true in the indigenous nations.
All right, we got to wrap there today. We'll have more briefing tomorrow. The governor's got to get back to the Capitol. Thank you, everyone, for joining.
Thank you all. Thanks to everyone. Thanks, folks.